What is the primary goal of maintaining a high hematocrit level during cardiopulmonary bypass? A. To prevent hypothermia. B. To ensure adequate oxygen carrying capacity. C. To prevent clot formation. D. To reduce the risk of air embolism. Answer: B. To ensure adequate oxygen carrying capacity. Explanation: maintaining an appropriate hematocrit level during cardiopulmonary bypass is crucial to ensure adequate oxygen delivery to tissues. A lower hematocrit can impair oxygenation, while too high a hematocrit increases the risk of clotting and thrombosis. Which of the following is most likely to be used to monitor the temperature of the patient during cardiopulmonary bypass? A. Thermistor probes. B. Pulse oximeter. C. Blood gas analyzer. D. Electrocardiogram (ECG). Answer: A. Thermistor probes. Explanation: thermistor probes are used to monitor the patient's core body temperature during cardiopulmonary bypass. Temperature regulation is critical during bypass, and thermistor probes provide real-time temperature data to ensure the patient remains within a safe range. In a cardiopulmonary bypass system, which component is responsible for removing carbon dioxide from the blood? A. Oxygenator. B. Roller pump. C. Arterial filter. D. Venous reservoir. Answer: A. Oxygenator. Explanation: the oxygenator is responsible for both oxygenating the blood and removing carbon dioxide. It functions similarly to the lungs by facilitating gas exchange, ensuring the blood is properly oxygenated and that CO2 is removed during the bypass procedure. What is the primary concern when monitoring the central venous pressure, CVP, during cardiopulmonary bypass? A. Fluid overload or depletion. B. Oxygenation levels. C. Hemoglobin concentration. D. Risk of air embolism. Answer: A. Fluid overload or depletion. Explanation: the central venous pressure, CVP, is an important parameter to monitor during cardiopulmonary bypass to assess fluid balance. A high CVP could indicate fluid overload, while a low CVP may suggest inadequate venous return or dehydration. The roller pump in a cardiopulmonary bypass circuit is preferred over a centrifugal pump because it: A. Has less risk of air embolism. B. Is more effective at controlling flow rates. C. Requires less power to operate. D. Provides continuous blood flow with minimal pulsatility. Answer: B. Is more effective at controlling flow rates. Explanation: the roller pump is preferred in most CPB systems because it provides precise control over blood flow rates by compressing the tubing, which ensures consistent perfusion. The centrifugal pump, though useful in certain cases, is less effective at controlling flow rates in a predictable manner compared to the roller pump. What is the role of ultrafiltration in a cardiopulmonary bypass circuit? A. To remove gases from the blood. B. To filter out excess fluid and waste products. C. To oxygenate the blood. D. To monitor coagulation status. Answer: B. To filter out excess fluid and waste products. Explanation: ultrafiltration is used during cardiopulmonary bypass to remove excess water and waste products from the blood, which helps reduce the hemodilution caused by the priming fluid used in the circuit. This process also helps maintain proper blood viscosity and electrolyte balance. Which of the following statements is true about the oxygenator in a cardiopulmonary bypass system? A. It only serves to oxygenate the blood and does not remove carbon dioxide. B. It works by directly mixing blood with oxygen. C. It utilizes a semi-permeable membrane to allow gas exchange. D. It is used to monitor oxygen saturation levels during bypass. Answer: C. It utilizes a semi-permeable membrane to allow gas exchange. Explanation: the oxygenator uses a semi-permeable membrane to allow gas exchange, oxygenating the blood while simultaneously removing carbon dioxide. This is achieved without direct mixing of blood and gas, minimizing the risk of air embolism. What is a common complication that requires close monitoring of the blood pressure during cardiopulmonary bypass? A. Hypotension due to inadequate perfusion pressure. B. Hyperthermia caused by excessive heat transfer. C. Hypercapnia from inadequate ventilation. D. Hypoxemia from inadequate oxygenation. Answer: A. Hypotension due to inadequate perfusion pressure. Explanation: hypotension during cardiopulmonary bypass can occur if the perfusion pressure is too low to maintain adequate organ perfusion. Monitoring blood pressure is critical to adjust flow rates and ensure that the organs are receiving sufficient oxygenated blood. During cardiopulmonary bypass, what is the primary reason for using an arterial filter? A. To prevent blood clot formation. B. To remove any bubbles or particulate matter. C. To maintain normal blood flow velocity. D. To monitor blood gas levels. Answer: B. To remove any bubbles or particulate matter. Explanation: the arterial filter is used to remove any air bubbles or particulate matter from the blood before it is returned to the patient. This is essential to prevent embolic events, which could lead to organ damage or stroke. In cardiopulmonary bypass, which of the following components is crucial for preventing clot formation during the procedure? A. Oxygenator. B. Heparin. C. Blood warmer. D. Inline blood pressure monitor. Answer: B. Heparin. Explanation: heparin is a commonly used anticoagulant during cardiopulmonary bypass to prevent clot formation. Since the blood is circulating outside of the body, it is essential to ensure that clotting does not occur within the bypass circuit, which could lead to complications such as embolism.